Welcome to You're in Good Hands, the podcast where we dive into everything urology, leading-edge treatments, education on a variety of topics, and expert insights to keep you informed and healthy. Brought to you by the Advanced Urology Institute of Georgia, where innovation meets compassionate care. Because when it comes to your health, you're always in good hands. As always, the information discussed today is purely informative and does not constitute medical advice. Okay, so you sent us some information on this low-intensity shockwave therapy list for ED. We're going to take a deep dive into it today.
That's good.
So I guess we should probably start off by defining what ED is exactly, and then, kind of see how this list therapy fits in.
Right. So erectile dysfunction, or ED, is, as you probably know, the inability to achieve or maintain an erection for sexual activity.
Right.
It's really common, actually, and it's not just a physical thing, The sources we've got here talk about the impact it can have on a guy's, confidence, relationships, even just his overall sense of well-being.
Yeah, definitely.
It'd be really tough.
So, LIST, low-intensity shockwave therapy, it's kind of a mouthful, but what is it exactly?
Yeah, so it's this non-invasive treatment. It uses sound waves.
Sound waves, okay.
To stimulate blood flow to the penis. The idea is that it kickstarts the body's natural healing processes to improve erectile function over time.
Okay, so not like a quick fix, like a pill or something.
Exactly. It's more about addressing the root cause of ED, not just masking the symptoms.
Gotcha. So let's dive in. How does this LIST thing actually work?
So basically, they use a little handheld device, and it delivers these low-intensity shock waves to specific areas of the penis.
So literally sound waves going into,
Yeah, exactly.
Interesting.
It sounds kind of weird, but it actually stimulates the tissue there and encourages the growth of new blood vessels.
New blood vessels, okay.
Yeah, it's called angiogenesis. And this is really important because, a lot of times ED is caused by poor blood flow.
Makes sense.
So by creating these new blood vessels, LIST can actually help to improve blood flow and therefore erectile function.
So it's not just like opening up the existing blood vessels, it's actually making new ones.
Yeah, it's pretty cool, actually. And the sources we've got here talk about how it's a painless procedure. No need for anesthesia or anything like that.
That's a plus.
Yeah.
Okay, so this sounds promising, but who is LIST actually good for?
Right.
Is it for everybody with ED?
Well, the sources we've got suggest it's most effective for guys with mild to moderate ED.
Okay.
So it might not be the best option for guys with more severe ED or for those with underlying health conditions that could be contributing to their ED.
Right, so it's not like a miracle cure for everyone.
Right, exactly. But for men with mild to moderate ED, it can be a really good option, especially if they haven't had success with other treatments or if they're just looking for a more natural approach.
Okay, so let's talk benefits. Besides being non-invasive and painless, what are some other advantages of LIST?
Well, for one, it doesn't involve taking any medications.
Right.
So no worries about side effects from pills. Plus, it's not just a temporary fix.
Yeah, you mentioned that before.
The goal is to actually improve erectile function long term, get your body working the way it should.
That's pretty impressive.
Yeah, it's a pretty amazing approach, actually. And because it's non-invasive, there's no downtime. You can just go about your day after a session.
Okay, so it all sounds pretty good so far. But are there any risks or downsides to LIST?
Well, as with any medical procedure, there are always potential risks.
Of course.
But with LIST, they seem to be pretty minimal. Some guys might experience some mild discomfort during the treatment.
Okay.
But it's generally well tolerated, and the sources note that serious side effects are very rare.
That's good to know.
But one thing to keep in mind is that it might take several sessions to see results.
Right.
They usually do a series of treatments, 6 to 12 sessions, spread out over a few weeks.
So it's not an overnight thing.
No, definitely not. And it's important to have realistic expectations.
Right.
It's not a guaranteed cure, and it doesn't work for everyone.
Okay, so let's say someone is interested in trying LIST.
Yeah.
What would be the, next steps?
Well, first and foremost, they need to talk to their doctor.
Right.
Get a proper evaluation.
Okay.
Because, ED can be caused by a lot of different things. So it's important to rule out any underlying medical conditions and make sure that LIST is the right treatment for them.
So it's not something you just order online or anything?
No, definitely not.
Okay, good to know.
It's a medical procedure, and it needs to be done by a qualified healthcare professional.
Makes sense.
During that consultation, they can talk about their medical history, the severity of their ED, and what their goals are. And then the doctor can help them decide if LIST is a good option and discuss the potential benefits and risks.
Okay, so to wrap things up, what are some key takeaways about LIST?
So we learned that it's a non-invasive treatment, uses sound waves to stimulate blood flow and promote the growth of new blood vessels in the penis.
Right.
It seems to be most effective for men with mild to moderate ED, and the goal is to improve erectile function naturally over time.
Not a quick fix.
Right, not a quick fix. It requires multiple treatment sessions, and the results can vary from person to person. It's not a guaranteed cure. But for many men, it can be a safe and effective way to address ED and improve their quality of life.
Awesome. Well, this has been super informative. Thanks for breaking it all down for us.
No problem. Happy to help.
And for all of you listening, remember, this is just a starting point. If you're interested in learning more about LIST, talk to your doctor. They can give you personalized advice and help you figure out the best course of treatment for you. And here's something to think about. Since this therapy is all about restoring natural function, how might lifestyle changes, like diet and exercise, play a role in enhancing those benefits? It's something to consider as you explore this option.
That's a great point.
Anyway, thanks again for sending us this information. We hope this deep dive has been helpful, and we'll see you next time. If you happen to be in Georgia, you can always check out Advanced Urology Institute of Georgia. They've got 10 convenient locations throughout Metro Atlanta. You can make an appointment by calling 678-344-8900 or go online to www.advancedurology.com.
Great advice.